My profound thanks to the Muslim Medical Mission for inviting me here today to speak in their August conference, in their August gathering. It's a pleasure, and up till now I've had a very enlightening session here, so I've learned a lot of things. So my talk is going to be on incorporating Islamic principles in medical education, and this is a disclaimer. I'm a practicing Muslim and a clinician, a medical educationist. I am a student of medical professionalism, but I'm not a religious scholar. So my talk, whatever I'm going to say, whatever I'm going to interpret, should be us peraye ke andar ke. I'm not a religious scholar, but whatever talk I'm going to give here is based on my observation, on my research, on what I have read, and what I understand about incorporating Islamic principles in medical education, being a student of medical profession, as well as a practicing Muslim. So how we're going to proceed in this presentation. We're going to talk about Islam being the complete code of conduct of life. We're going to talk about profession. What is profession? What is medical professionalism? We're going to talk about the models of medical professionalism, how society believes medical professionalism, what does it mean, and how to incorporate Islamic values in practice of medicine, and eventually we are going to come up with a contextualized model for medical professionalism in this talk as well. So we, as Muslims, believe that Islam is the complete code of conduct of life, and it guides people in all aspects of their lives, including socio-cultural, ethical, legal, spiritual, etc. So it's encompasses our life completely, our entire personality, value system, so that it gives that to each and every individual. And what is medical profession? So to understand medical profession, we need to understand what a profession is. So profession is not unique to medicine. So koi bhi, like plumbing is a profession, engineering is a profession. So if you have a unique body of knowledge, a unique skill associated with a group of individuals, and a certain attitudes related to the delivery of that knowledge and skills, and that community is custodian of that unique body of knowledge, skills, and attitudes, then that is a profession. And since we are a custodian of a unique body of knowledge, skills related to medicine, and certain attitudes in the delivery of that knowledge and skills, we belong to the community of medical practice. There are various frameworks that identify or define what medical professionalism is. And this, for example, is a Western framework or model for medical professionalism. And the interesting thing about even the Western model of medical professionalism is that the clinical competence, that the knowledge and skills associated with medicine is only just the foundation, or a very limited portion of what the entire framework of professionalism is defined by them. The large majority of the rest of the framework deals with how we basically deal with ourselves, with other people, with our patients, with the society around us. So that's a very important thing that we should remember. So just having the knowledge of related to medicine and the skill to practice medicine is not enough. There are certain attitudes, there are certain value systems, there's certain morality associated with the delivery of that practice. And the same goes with the certain other models of medical professionalism. For example, the Chinese model, which also identifies competence as a very limited area, but a large amount of medical professionalism framework is defined by other areas, including humanity and professionalism, altruism, and other areas, and further refined by the Peking University. It sort of projects the same idea there as well. So the reason for giving you these various models around the world is that even outside the Islamic world, people believe that value systems, morality, how we practice medicine, how we interact with other people, with our peers, with our seniors and juniors, and with our society has a very important component within the practice of medicine. Even in Japan, for example, they have a strict Bushido code in which they touch on 7 areas which if you look at it, the majority of those areas, rather the entirety of those areas are related to things that are related to the value systems rather than the competence related to medicine itself. The Arabian model, also the Four Gates model presented by Al-Iraqi in Saudi Arabia, is also sort of focuses on self-awareness, self-management, excellence and commitment, keeping professional confidentiality, self-accountability is very important, and self-motivation, expecting reward from God and not people. So when we talk about the Islamic perspective, so there are hukuk Allah and hukuk al-ibad, and at least I'm a firm believer when we say कि Allah Ta'ala बहुत सारी चीज़ें माफ़ कर देगा हमें, तो वो that relates to hukuk Allah, but not our जो हम अपनी गलतियाँ करते हैं related to hukuk al-ibad. And that's also sort of presented in our Sharia law. But what does the society and profession in Pakistan think about what medical professionalism means and how it is related to the Islamic perspectives and the principles and value systems of Islam? So there was a large study that was conducted in Pakistan, more than 53 focus group discussions, including more than 600 individuals, stakeholders, policy makers, doctors, allied health sciences, teachers, students, as well as patients all across Punjab. And they came up with very, so some of the quotes I'm presenting here that came out of that study. So it was a qualitative study, and therefore it is presented in codes, and there were certain themes that were derived from that study. So as you can see, a large number of individuals, whether they were educated or not educated, whether they were patients or policymakers or doctors, attributed a large amount of value system to their understanding of how medicine should be practiced. So Allah Almighty is watching us, and our attitude towards everyone, and we are responsible for our deeds. If no one else is watching us, we as Muslims believe that Allah is watching us. Religion also affects the behavior, but we don't have the proper religious knowledge. And even if we do not practice it. So just having knowledge of religion is not enough. The most important thing is execution. Fear of Allah Almighty keeps us from doing wrong. A doctor that fears the day of judgment will never harm his patient intentionally. For a doctor, professionalism, it is not enough to have desired experience, but ethics does matter a lot. So these are quotes from that study, and there were hundreds of similar quotes from that study. And what themes were derived out of these quotes from this qualitative study? The most important themes were value-driven, which included spirituality, morality, and humanism. There were other themes related, like competent and responsible professional, effective manager and effective leader, and being supported. But values was a very important pillar that came out of that qualitative research. And basically how they defined it was that a medical professional is encompassed by certain values that are related to morality, to spirituality, and to humanity. And in those values, the focus was on Islam as the source of moral and professional values, belief in divine healing, belief in divine retribution, empathy, sympathy, and kindness, showing humility and respect, conscientiousness, a belief in inclusivity that we talked about earlier as well in one of the talks, maintaining a balance between ethics and cultural norms, and dealing with cultural taboos with morality and ethics. But importantly, Islam as the source of moral and professional values. So all that morality, all those values, all those moral compass comes from the Islamic principles and from the values derived from Islam. And the reason they said that was a person who believes in a certain degree of external accountability, fears Allah, fears from the day of judgment, will hold himself accountable and will believe that if he does harm to any patient, to his peers, to the society, to his profession, will be accountable not just in this world, but in the world hereafter. So that is important. But one of the important themes, one of the important aspects of this value driven system of medical professionalism is that is related from this quote. I see my fellow professionals observing stringently the timing of 5-time communal prayers and portraying themselves to be very religious and at the same time practicing medicine quite unethically. So they identify that there was a gap between what they internalized as being Muslims and how they actually externalized those value system in their practice in the daily dealings. And that's where we come up with how we can teach and inculcate Islamic values in our undergrad or postgrad education on our daily lives. So in a curriculum that we teach in undergrad or postgrad education, there's a formal curriculum, there's an informal curriculum, and then there's the hidden curriculum. The hidden curriculum are all those attitudes and all those behaviors that people learn from their peers, from the culture within that institution, from the role models and from the usatza. So अगर हम खुद ही पंक्चुअल नहीं होंगे, हम खुद झूठ बोलेंगे, अगर हमारी डीलिंग विद पेशेंट गलत होंगी, हम साइफन करेंगे पब्लिक पेशेंट्स को प्राइवेट पेशेंट्स, विल बी टेकिंग मनी एंड गिफ्ट फ्रॉम पेशेंट्स, वी विल बी कॉन्स्टेंटली bickering and fighting with our colleagues over various aspects of our lives. We will not be the role models that our coming generation of medical professionals will be able to, internalize those values. So, हमने behavioral sciences, University of Health Sciences में आपको शायद याद हो कुछ लोगों को 2007 में शुरू की. And then we carried it, though that study to identify कि उसका फ़ायदा क्या हुआ over the next 5 years के बाद जब वो लोग graduate हुए, तो we tried to identify कि उसको कोई फ़ायदा भी हुआ, and we realized कि आपने उनको जो कुछ पढ़ाया है उसको कोई फ़ायदा नहीं हुआ. But because once they hit the actual place of work, they did exactly what everybody else was doing in that place. So ना वो consent लेने का, ना वो communication skills का, ना वो confidentiality का, उनको पढ़ाने का किसी किस्म का कोई फ़ायदा नहीं हुआ क्योंकि उनके role models, उनके workplace, वो culture, वो उस तरह का exist ही नहीं करता था. So role modeling, being good role models, being good role models with Islamic values is important to incorporate those values in our coming generation. And this is a framework that I would like to present. Just kind of knowledge, skills, and attitudes जो हैं related to medicine ही नहीं, but Islamic code of conduct and morality, humanity, values, and ethics related to that code of conduct should be part of the role modeling system. And the same here as well. And we come to the end of the presentation. Thank you very much.